is Ashika Pillay. I'm a medical doctor, Wits graduate. Currently work in holistic well-being. I am a coach as well as a mindfulness teacher, and I work with individuals, corporates, and universities with respect to holistic well-being, mental and physical health as well. Yeah, I love this question as well, and I think there are many things that give me hope, particularly in South Africa. Definitely when there's resource constraints, there's something called the innovation sandbox, which allows us to start to innovate and do things from the resources that we already have. What I have noted or noticed in universities and in other communities is the use of digital technologies to aid mental health, to aid access, to aid support with the use of digital platforms. Even things like AI chatbots, I believe, are being used by certain universities. So there's a lot of potential for digital technologies to support us, especially when it comes to access and availability, and to it being more financially accessible as well. On the community-based front, I think this is very exciting. There's a lot of development here as well, where we can train community-based workers, have some level of training to help with screening, to help with support of mental health issues in communities, especially rural communities. I read of an interesting program called the Friendship Bench. You may want to look this one up, where started in Zimbabwe and being rolled out all over the world, and actually there's case studies in South Africa as well, where elders are trained, so-called grandmothers are trained to literally sit on a wooden bench with a patient, doing problem-solving exercises around their diagnoses. And I think some of this work was done around patients with HIV. So community-based models have a lot of potential. There are NGOs like SADAC, the South African Depression and Society Group, who actually train lay counselors to support their call center. And this is a free service; anyone can actually access it. I think our government policy is supporting the use of mental health frameworks and mental health accessibility in our primary health care system. So that's a third kind of approach that's giving me hope. Universities, of course, are the nuclei of research, of innovation. And I think we're seeing some of this here: anti-stigma campaigns, blended care models for healthcare, for mental health care particularly. So that's another element of innovation and of forwarding or pushing the agenda of mental health forward. And I think the last one, a very important one, is around youth advocacy. There are several organizations where the youth are stepping up with introducing the impetus for policy change around mental health. And you are the youth, your voice matters. So the change starts with all of us in terms of changing the landscape, the framework, the implementation of mental health in our country. And I think what's very important is that it's not just medical students. All students need to be aware of their mental health and to seek support. With medical and allied health students, I think the pressure is different, probably intense in different ways. The pressures of dealing with high volume work, of dealing with sick patients and patients needing support themselves, of working in a fragmented, in a healthcare system that's ailing itself. And of course, the pressures of studying, of academic performance, put quite a significant amount of pressure, together with, of course, the time that you study for. You study for longer when you're a medical student, particularly. So the pressures are there, and the awareness of what health or what help you need is also important. Remember that mental health is a holistic picture. You need to be physically well. So what are your physical issues at the moment? Things like diet, like sleep, like exercise, they inform our mental health. Maybe some students may need emotional support, how to deal with stress better, how to deal with anxiety, how to deal with past issues, PTSD, things like that, trauma in the past. And they may particularly need the help and the guidance of a professional healthcare worker in order to be able to guide it to the right level of support. Importantly, cognitive health. How's your mental health? What level of support do you need there? Are you understanding your work? Do you need support with that? Do you need support in terms of managing time, managing boundaries, managing and your balance better? And then, of course, as well, but last but not least, is spiritual well-being. Some people may need help with getting direction towards a spiritual elder, towards learning how to be kinder, to be practice gratitude for themselves. So the spectrum of mental health is broad and wide, but we don't have to go it alone. As far as I can read, many of the universities have support structures in place. Things like the Office for Student Success, Campus Health and Wellbeing, career and counseling centers, they're all there. I think the important message is that you don't have to deal with your mental health issues by yourself. Seek the support, understand what and where the balance may be off, and look for the appropriate level of guidance in that. I think we all realize that our youth and our university students particularly are under a lot of pressure. And I think the mental health landscape of this population of people is of particular concern. The issue really is the amount of undiagnosed and untreated people that we have with mental health disorders in this group. As you would know, whether you're a first year or not, adaptation to university is particularly challenging. And that is not even considering the other ancillary context issues that may help or add to mental health disorders in our communities. I think I read a statistic that said that about 20%, only 20% of people who with mental health disorders are actually diagnosed. And only 20% of those actually receive treatment. More students than not will not seek help. And some of those reasons are, stigma, the thing that we know a lot about, shame, difficulty in accessing services, availability of services, busyness of schedules, possible mistrust issues with the service providers or the services themselves. And of course, we all know that we live in a resource-constrained country, so access and availability is an issue. I think overall, the awareness is definitely increasing, but I think what remains is that there's a lot of work to be done. I think the spectrum of what we're seeing today is definitely changing and evolving. And as we know, mental health can also change and evolve as context changes. I read a study that said that in the past we had definitely more mood disorder type mental health disorders like depression. And now we're seeing more anxiety-based disorders. So there's definitely that shift between mood and anxiety-based disorders. Secondly, I think digital and technology availability has definitely had an impact on student health and well-being, and in fact in the population in general, as we know. Things like digital addiction, FOMO, cyberbullying, its impact on sleep are definitely more prevalent. We are also either seeing higher prevalence or we have a greater awareness of neurodivergent disorders. And things like PTSD, they're either happening more or we're more aware of it. And I think different studies differ in how they speak about that. What's also very important to note is that substance abuse and things associated with alcohol and other drugs are more prevalent. I also think that unlike the past, we are somehow normalizing the conversations. So we're speaking about this a little bit more, and we are probably getting to deeper layers of the conversation. of mental health, especially with students. A very important aspect in the workplace. Mental health, engagement, and burnout are rife not just in the medical industries or the medical communities, but also in the general corporate industries. It's something that is a huge challenge. It leads to mental health issues, not just in the structure of the organizations that they work in, but then of course ends up spilling over into the environment as well. So it's definitely under-addressed, it's under-acknowledged, and it is a workplace phenomenon. Burnout is a workplace phenomenon. It needs more time and more focus and more action. For those of you in the medical field, if that's where you're at, the biopsychosocial model is one that speaks about the intricate connection between mind, body, and spirit. And this is a very important element, sometimes maybe spoken about in your medical training. Chronic conditions require mental and emotional support. They're often the result of lifestyle changes, which, with the right level of coaching and compassion, can help people to mitigate the worsening of their conditions. So in the case of the support that is needed, both for the medical professional and the patient itself, I think what's important is that we continue to move towards a team-based approach to patients that need medical help, and we support them from all aspects of who they are as holistic human beings. Stigma is definitely one of the biggest hurdles to people, students, the general community accessing healthcare. It's the unspoken belief that exists in a community or a group of people that leads to discrimination, which is defined as stigma. So if we think about that, the way in which we can help to mitigate it, it's going to take time. Is to start to speak about it. It's about creating ventilation around this topic. It's about people like leaders like you and I. If it is a set of beliefs that's held by a group of people, we make up that group of people. So it starts with you and I. It starts with our mental health. It starts about how we speak about that, how we allow that to surface, to be seen, to be heard. And when we do that for ourselves, when we see our own mental health issues and when we see those of those around us, we start to give permission to people to also start to speak up. So we are definitely seeing changes in stigma, I think, in the community at large, in the student population as well, in providing support structures. There's a lot of work to be done. Maybe start that question looking at what the WHO actually defines mental health as. And there are kind of 3 or 4 elements of this definition by the WHO. I think the first is mental health is the capacity to understand one's abilities, to be able to learn well, to be able to work well, to be able to manage the stresses of life in a healthy way, and to be able to provide support and to make an impact in our communities. So if we look at that definition of mental health, where would we start and what would be the kind of most profound place of change? And of course, it has to start earlier on. In my view, if I could change one thing, I would say, how do we integrate the conversations, the learning, the life skills around mental health and well-being from early on, from school, where we start to talk about emotional resilience, where we start to talk about how we thrive as human beings, what is our optimal well-being, rather than solving the problem of a mental health crisis. So if we start early, we start the conversation early, we most likely will address the issue of stigma early. We will most likely start to develop young leaders in mental health and innovation. and of course leading that downstream into university-based education, where mental health, emotional resilience, and not just coping but thriving, helping us be our best selves in the world, to be the future leaders. As university students, you are the healthcare innovators of the future. You are the politicians of the future. You are the leaders of the future. You are the parents of the future. So if we can start this conversation earlier, if we normalize the conversation, then we reduce the stigma, the shame around mental health. And if I had that magic wand, that's where I'd start, right there at the beginning, at school, and into your tertiary education.